If someone dies with COVID-19, we are counting that as a COVID-19 death.
Now, I can't imagine if someone comes in with coronavirus, goes to an ICU, and they have an underlying heart condition and they die, they're going to say cause of death, heart attack. I cannot see that happening.
That was from yesterday's White House briefing, and it sparked a nationwide debate over how we count deaths from COVID-19. Do we count someone who tests positive for the virus but died of pneumonia as a COVID death? But what about someone who dies with symptoms of the disease but was actually never tested? It's actually crucial information. COVID death stats inform the models that guide federal and state governments' responses to the crisis. It's really important. Now, Italy, very interesting, has been grappling with the same debate for weeks. I mentioned it 2 weeks ago. I'll mention it again. Here's what the Daily Telegraph reported. According to Professor Walter Ricciardi, is the scientific advisor to Italy's Minister of Health. This is what he said. He said, the way in which we code deaths in our country is very generous in the sense that all people who die in hospitals with the coronavirus are deemed to be dying of the coronavirus. On reevaluation by the National Institute of Health, only 12% of death certificates have shown a direct causality from coronavirus, while 88% of patients who have died have at least one pre-morbidity. Many had 2 or 3. My next guest is a doctor and state senator in Minnesota who is deeply troubled by the CDC's latest guidance for counting COVID deaths. Dr. Scott Jensen joins me now. Doctor, I want to read for our viewers what the CDC says in part about how to count COVID deaths relating to that last issue we just raised. In cases where a definite diagnosis of COVID cannot be made, but is suspected or likely, like the circumstances are compelling with a reasonable degree of certainty, it is acceptable to report COVID-19 on a death certificate as probable or presumed. So, doctor, what's the problem with that?
Well, in short, it's ridiculous. The idea that we're going to allow people to massage and sort of game the numbers is a real issue because we're going to undermine the trust.
Doctor, in that same CDC guidance sheet on COVID-19, it references the fact that basically this is a judgment call for doctors as far as contributing factors and ultimate cause of death. But they concede that it is a judgment call. Again, why is that not correct?
Well, let's just take influenza. If I have a patient died a month ago, had fever, cough, and died after 3 days, and maybe had been an elderly, fragile individual, and there happened to be an influenza epidemic around our community, I wouldn't put influenza on the death certificate, and I've never been encouraged to do so. I would put probably respiratory arrest would be the top line, and the underlying cause of disease would be pneumonia. And in the contributing factors, I might well put emphysema or congestive heart failure. But I would never put influenza down as the underlying cause of death. And yet that's what we're being asked to do here.